मेरा नाम सुमित है, मैं मथुरा से बिलोंग करता हूँ। मेरा हेयर लॉस हो रहा था तो इसकी वजह से मैं बहुत परेशान था। यूट्यूब के ज़रिए डॉक्टर सारस्वत सर का मुझे पता लगा, वहाँ पर मैं गया। फिर वहाँ से मैंने सर से कंसल्ट किया। सर से कंसल्ट करने के बाद सर ने मुझे हेयर ट्रांसप्लांट के लिए बोला कि आपका, लेकिन मेरी हेयर की क्वालिटी जो है वो काफ़ी थिन थी, काफ़ी पतले हेयर्स थे। सर ने कहा देखिए ट्राई करते हैं, बहुत अच्छा रिजल्ट आएगा। सर ने भरोसा दिया मुझे, स्टाफ भी काफ़ी सपोर्टिव रहा। तो मेरा 31 दिसंबर 2022 को मेरा हेयर ट्रांसप्लांट हुआ। उसका रिज़ल्ट मेरा ये है। अपने रिज़ल्ट आगे के क्राउन एरिया से काफ़ी ज़्यादा खुश हूँ। जैसा मैंने एक्सपेक्ट नहीं किया था उससे भी अच्छा रिज़ल्ट आया है। डॉक्टर सारस्वत सर की पूरी टीम को मेरा धन्यवाद। मेरा रिजल्ट काफ़ी अच्छा रहा।
We get a lot of patients who are grade 7 Norwood male petal baldness, which means that they have the highest degree of hair fall and hair loss. And many of such patients have been refused by many clinics for hair transplant because grade 7 is the grade where the donor site is very limited. And if in addition to being a grade 7, your donor site is very thin, then you can expect that this is going to be a very challenging case for the doctor and the team. In this video, we will discuss and showcase results of one of our patient who was grade 7 at an early age, suffering from depression because of that, and at the same time had very thin hairs in the donor side. We had discussed all these problems with him during our first consultation. We would like you to keep on watching this video till the end, where we show his combing videos, his results from the front, and how he feels about this. So we would request you to watch this video to see the results of grade 7 male pattern baldness and how we plan out the surgeries in these cases. Generally, we plan the hair transplant in a grade 7 baldness patient in 2 sittings, where we do the front and the mid scalp up to the transition zone in the first sitting, and we address the crown in the second sitting, as we are planning to do a second sitting for this patient in the coming days and months. Hi, I'm Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon and an American board certified hair transplant surgeon, and in the field of hair transplant for more than 17 years, and have treated more than thousands of patients of hair loss and hair transplant. We are also involved in training a lot of doctors, and we have trained more than 90 doctors from 25 countries in the field of hair transplant. Do subscribe to our channel if you want to keep on watching such interesting plannings and the results of such patients. Before we discuss the hair transplant part of Mr. Sumit, we would like to discuss the way he presented his problems with which he came. So he presented to us in December 2022 with a long-standing history of hair loss for many years, and had tried some treatments with his local doctor at his local place, but unfortunately they did not work out for him, and he progressed over a period of years from initial frontline hair loss to being a grade 7 male pattern baldness. And by the time he was grade 7 and his medical treatment had failed and he started looking out for hair transplant, he came to know about our hospital and our clinic, and then he approached to us. When I first saw him in the consultation, he was extremely shy, he was depressed, his body language was very pessimistic, and he was very hopeless about the future. What is going to happen? He was not able to make even eye contact with me. So we have a natural sympathy for such patients who have a lack of confidence because of such extreme hair loss in such an early age. So with due empathy to him, we discussed his procedure. Then we did his trichoscopy, which is a software based analysis of your donor site, and in this we see the thickness, the density of the donor site, we see the average number of hairs per graft or follicular unit, what is this total donor site dimensions, what are the total number of follicular units available in this case, and how many we can extract in a single sitting. So we found out that his average hair thickness was around 0.067 millimeter, although many of his hairs were very thin and some of them were on the thicker side also. His average hairs per follicular unit were on the lower side, that is around 1.9 hairs per follicular unit, although he had a good density of around 80 follicular units per centimeter square at his donor site. In his donor site, he had almost 11,500 to 11,600 follicular units available, and from the front line to the transition zone, his area was around 128 centimeter square. So we planned a density of 35 follicular units per centimeter square because we wanted to preserve some roots for the crown also, and with the average density of 35 follicular units per centimeter square in this area, we planned around 4,500 grafts in this case. So he was okay with the planning and he came in a good faith, and he said that, doctor, you are the first doctor who has given me some hope, and I would really like to proceed with the hair transplant procedure. So we did his procedure on 31st December 2022, and he was hopeful that 2023 will be very good for him. We did around 4,500 grafts, and the number of 1 hair, 2 hair, 3 hair and 4 hair grafts are shown on the screen, which you can see, and the average yield of hairs per follicular unit is also shown to you on the screen. You can see at the relevant data here. But the procedure was successful and it went uneventful. Initially, in the patients we have seen who have thin hairs in the donor side, the growth doesn't happen very quickly in the initial months, and we have had many late bloomers in our practice, especially with the patients who have a thinner donor side. So initially he was a bit concerned, but we were confident of our work and what we had done for him. So he kept on coming month after month for the routine follow-up, and he was extremely sincere and serious in his follow-ups, and we also kept on watching him, and we did a lot of PRPs for him. We advised him medical treatments, and initially he was a bit concerned, but slowly after around 5 to 6 months we started seeing good growth in his case, and he came to us at around 11 months when he gave this testimonial video to us, and he was extremely happy. And you would be surprised that he went to one of the very famous deity of Hindu religion, Banke Bihari temple, and prayed for us and our entire team, and he brought the prasad, and we were very much touched by this gesture of him. And he says that he has a new hope in his life, which Saraswat Hospital, its team, has brought to him. Do like this video if you really happy about the transformation which Mr. Sumit had. You can call us if you have such problems, if you want us to reach out to you with your contact details, or if you have any queries about your genuine hair problems, you can always approach to us, and you can write down in the comment section below. We have discussed a lot of patient testimonials, so you can check out the patient testimonial in the link given above. But just to run through the steps we do in our hair transplant procedure is, we do a sensitivity test, we do an ECG, and then we mark the hairline, and then we trim the hairs, give local anesthesia, make slits keeping in mind the natural angle and direction of each area of the scalp, and then we start with the graft harvesting. And our machine is a very specialized machine for hair transplant, which has a counter. We use best quality punches, and the machine has a very low torque and low rotation speed, giving us the best quality grafts. And then the insertion step is done by the technical staff under our supervision by either forceps or implanter pen, whichever we think is suitable for the patient and patient agrees to that. So these are the steps we do, and we did the same in his case also. Do watch this video if you want to know the cost of hair transplant.